Hello, party people. I'm back. It's another Wednesday for all things health. Today we're doing STI Talk, and we will be talking about herpes. So, of course, my name is Monique. I am the community health coordinator here, and my pronouns are she, her, hers. Of course, you know how we do. Hey! Of course, you know how we do. We like to do our housekeeping rules first. So, I'm going to read my little spiel, and then we'll get into the topic. So, Whitman-Walker Health's Community Health Department has expanded its outreach effort to the social media platform. That's UIG. We cover various topics about HIV, STI sexual health practices, access to care, social determinant of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. Oh yeah, I'm still here. We're not at Easter Market though, so call me and I'll let you know which location I'm at. I'm usually at the Max Robinson Center on MLK on Thursdays and Fridays. I'm usually there, or on Wednesdays, I'm usually over in Northwest. So just let me know when you want to come, stop by, and I'll let you know where I'm at. All right, so we're talking about herpes today. So I decided to talk about herpes today because for like the last 2 weeks when I've been testing, that has been like the major question. Like, oh, do you guys test for herpes? So y'all know here we test for STIs, Chlamydia and Gonorrhea via oral, rectal swab and urine. So that's how we test, and then we do a blood draw for syphilis. We don't test for herpes. Now, the reason that we don't test for herpes is because what I'm about to talk about in a minute. But you can request herpes testing at our STD clinic that happens throughout the week. But when you request it, you have to be like showing symptoms. Usually if you don't have symptoms, probably won't test you, and I'm about to get into why. So, like I said, for the last 2 weeks, people, young, old, in between, have been asking me why we don't test for herpes, and let's get into why. So before we get into it, it's very important to know what herpes is. It's a common virus that causes sores on your genitals and your mouth. Herpes can be annoying. It could be painful, especially if it's in the genital area, but it usually doesn't lead to like serious health problems. It's actually super common, which is one of the reasons why we don't test for it. And it stays in your body for life. My live last week, I told y'all that anything that my doctor when I was growing up told me that anything starts with an H stays with you forever. So that's herpes, HIV, Hep, anything that starts with an H stays with you for life. So while it's super common, doesn't really cause you any serious health problems, it is with you for the duration of life. More than half of Americans have oral herpes, which is usually like a cold sore, or like people also call it like a fever blister. And about 1 out of 6 Americans have genital herpes. So chances are, you know somebody that has had it, whether it's like a cold sore, or you have had it like a cold sore, or genital herpes. So herpes is caused by 2 different but similar viruses, herpes simplex 1, which we usually in the health field just say HSV1 or HSV2. HSV1 is usually the virus that causes cold sores. HSV2 is the virus that causes genital herpes. However, both can be found in either area, in the oral area or in the genital area. So both, like I was saying, both kinds can make sores pop up on or around your vulva, vagina, cervix, anus, penis, scrotum, butt, inner thighs, lips, mouth, throat. Sometimes, but very, very, very rarely, it can also show up around your eyes if you like touched your eyes. With that being said, when you get either herpes simplex 1 or herpes simplex 2 around your vagina, because even though 1 is usually the cold sore and 2 is usually genital herpes, you can have either one in either area. So when you usually have it on or around your genitals, it's called genital herpes. And when it's on or around your lips, mouth, throat, it's called oral herpes. Again, sometimes we call it cold sores. I think I've always heard it called cold sores with young people. Older people usually call it fever blisters. Same thing. So herpes simplex 1 usually causes oral herpes. Each strain, like I said, you can have either one in either place, but each strain prefers to thrive in its regular area. So herpes 1 usually thrives in the oral space. Herpes 2 usually thrives in the genital area. You can get herpes simplex 1 in your genital area, like if somebody had a cold sore and performed oral on your genital area. That's how you would get it. Genital herpes is a common sexual transmitted disease that any sexually active person can get. Most people with the virus don't have symptoms, which is another reason why we don't test for it unless you're having symptoms. So most people live with it, don't know, even without signs. But even without signs of herpes, you can still spread it to your sex partners. So that's important to know. Herpes is spread from skin to skin contact with infected areas. Herpes causes outbreaks of itchy, painful, especially in the genital area, painful sores and blisters that come and go. Many people with herpes don't notice the sores or mistake them for like something else, like a pimple or an ingrown hair, and things of that nature. So you can absolutely spread it even if you don't have any sores or symptoms, because remember, it doesn't, just because you're not having an outbreak, which we'll talk about soon, doesn't mean that, it's gone. Like, it starts with a H, stays with you forever. Herpes can be passed even if the penis or tongue doesn't go all the way into the vagina, anus, or mouth. You do not have to come to spread herpes. All it takes is legit like skin to skin touching of the infected area. And you can also get herpes from kissing someone who has a cold sore or a fever blister. Other areas of the skin that might get infected, remember that I did say the eyes can also be, even though it's rare, it can also be infected, and they're also easily infected, and that's just like you touching against, and then you like rub your eyes because it's itching or whatever, transfer. So other areas that may get infected, if there's a way for herpes to get in, like a cut, a burn, a rash, other sores that you may have, anywhere where there's broken skin and you happen to have skin to skin contact with someone who does have herpes, you can transfer. So you actually don't even have to have sex to get herpes. Like if like a parent has a cold sore, kisses the kid on the lips, like a parent can transfer herpes to their child like that. Most people actually do get oral herpes when they're kids. A mother can pass genital herpes, to a baby during vaginal birth. However, that is not very common, but it is still a cause for concern. Herpes is most contagious when the sores are open and wet, of course, because fluid can transfer from the blisters and easily spread the virus. But, which I actually learned today, because I definitely thought like the blisters had to be open. And for like, and when I say fluids, like, when you have a sore and you like scratch at it or whatever and it get moist or whatever, that's the fluid that I'm talking about. But something that I learned doing my research is that herpes can also shed and get passed to others when there are no sores and your skin looks totally normal. Most people get herpes from someone who doesn't have any sores. It may live in your body for years without causing symptoms, so it's really hard to know for sure when and how you got it. So even if you are going to get tested for herpes because you do have symptoms, the provider would not be able to pinpoint like when you got it or how you got it, because again, you could have it for a long time, for years, and not have any symptoms. Because the virus dies pretty quickly outside of the body, you cannot get herpes from hugging, mind you, outside of the body. You cannot get herpes from hugging, holding hands, coughing, sneezing, or sitting on toilet seats. Everybody likes to think that you can get all the infections from sitting on toilet seats. No, you will not be able to get it from there because it doesn't live long outside of the body. So a lot of folks don't have symptoms, but if you do have symptoms, sometimes people confuse herpes symptoms with other things. Like I said earlier, pimples, ingrown hairs, and the flu. Because remember, genital herpes can make you like, it can be painful and it can make you sick. Herpes symptoms come and go, but that doesn't mean that the infection goes away or that you can't spread it to other people. Like I said before, anything with the H, have to keep reiterating that, does not go away. So it stays with you in your body for life. The most common symptoms for genital herpes is a group of itchy or painful blisters on the vagina, the vulva, the cervix, the anus, the penis, the scrotum, also known as your balls, the butt, or inside your thighs. So the blisters break and then they turn into sores, which makes them painful. Other symptoms that people may have as well is burning when you pee, because your urine touches the sores, so it stings. Having trouble peeing because the sores are like swelling and blocking your urethra, itching, and pain around your genitals. If your genital herpes is caused by herpes simplex 2, you might also have flu-like symptoms. Swollen glands in your pelvic area, your throat, under your arms, feverish chills, headache, feeling itchy or tired, which are like, feeling achy or tired, which are like regular symptoms for like, even if you have like the common cold, right? So you just never know. That's why you have to be super careful with your health, especially like, if you plan on having, engaging in sex with another person. You just have to make sure that you're good and you know that that person is good, which is why it's very, very important to get tested. I know that I just said that we here at Whitman-Walker Health don't test for herpes unless you're having symptoms, but there are other places that do test. I think you still would have to request it, but there are other places that do test, like DC Health and Wellness Clinic, that's on P Street Northeast, across from maybe like 2 blocks from the NOMA metro station, which is the red line. They definitely test, but make sure that you ask so that you can get those services. When blisters show up, it's called an outbreak. The first outbreak, also known as the first episode, usually starts between 2 and 20 days after you've been infected with herpes. But sometimes it takes years for the first outbreak to happen. I just mentioned that, a lot of people go a really long time without having any symptoms. So for some people, it does take years before the first outbreak happens. The first herpes outbreak usually lasts between 2 to 4 weeks. Then, when the blisters go away, they go away, but of course you still have herpes. And it's really common to repeat outbreaks, especially in the first year that you have herpes. As the years go on, the outbreaks become less and less. They also become less painful. and less to the point that you may not have symptoms anymore. But again, always remember, it would still be in your body. It's for you, with you. The first outbreak is usually the worst. I just learned that today as well. Is usually the worst. Repeat outbreaks are usually shorter, less painful, and I just mentioned this. Most people with herpes get fewer outbreaks as time goes on, and some stop having them altogether. What else? Other herpes symptoms. So we talked about genital herpes being painful. Oral herpes is less painful. Doesn't make you feel as sick. It causes sores around your lips and your mouth. But you can also get them inside your mouth. What else? Cold sores usually last for a week, then go away. You can go to CVS if they're like right on your lip. You can go to CVS and get, I think the medication is called Abreva, but there are also some other ones that you can use that can help speed up the process so that the cold sore goes away quicker. But yeah, the Abreva does not work in the mouth. It's usually literally if it's around the mouth. For any sores within the mouth, you just have to wait for that to go away. They usually can pop up again within weeks or months. Again, I think I mentioned earlier that usually most people get herpes simplex 1, which is the cold sores or the flea blisters, while they're children. However, while it's not dangerous like in your younger years, it is really dangerous to newborn babies because they're fresh out the womb. They don't have like the antibodies or the protection that we as adults have, even as like young children have gotten. So it's especially dangerous to newborns. So if grandma has a cold sore and she want to kiss the new baby, absolutely not. Like, that's not cool. It can be very dangerous to the newborns. But even though there's no cure for herpes, there are treatments, ways to manage the infection. Your doctor will tell you the best treatment and method for your specific situation. What happens during a herpes test? So, again, Whitman-Walker Health does not test for herpes regularly. Like, when you come in for HIV, STI testing, we'll do those, and we specifically test for chlamydia and gonorrhea. We do blood draw for syphilis. We can test you for herpes if you appear with symptoms. If you're not having any symptoms, we won't test you. Chances are, more than likely, you have it, right? Because more than half of us have it from having a cold sore, right? So if you do, what happens during a herpes test, if you do have blisters or sores, the doctor will take a sample of the fluid, because remember I told you that the sores are going to be like wet and moist. So the doctor's going to take a sample of the fluid with a swab, like a cotton swab, and test it. If you don't have any sores, depending on where you go, they may test you, but they would have to do a blood test for that. But like I said, herpes tests aren't normally recommended unless you do have symptoms. So what's the treatment? Like I said, you see your doctor, they'll figure out the best treatment for you and your situation. Again, there is no cure, only treatment. But there are plenty of ways to treat it. Herpes medicine, like Abreva that I was talking about, it shortens the time of the infection. It makes help to go away sooner or prevent them from coming back so often. You let your doctor know like what's the course that's happening with you. Like, I get outbreaks every 4 weeks. The doctor might prescribe a medication that's more aggressive so that you don't get them so often. So you just, let your provider know what's happening. But outside of medicine, there are also like some ways that you can help like ease the pain. So if it's genital herpes, like they recommend like keeping your genital area dry because moisture makes the sores stay longer. wearing loose, soft clothing. If you have some downtime and you're at home, putting ice packs on the sores, or taking pain reliever if they're like really painful, because again, the genital herpes can be very painful. Taking like aspirin, Advil, Tylenol, stuff like that. Okay, so and also having big also, having herpes can make it easier to get HIV because the sores give HIV an open path into your body. So always use condoms to help protect the spread of both herpes and HIV. Okay? So that's all my info that I have on herpes. I know it's a lot. I know it's probably also kind of scary because you can have it for a long time and not know. All it is skin to skin contact. You don't even have to have sex to contract herpes. But again, just, knowing who your partner is, knowing, keeping yourself educated on what you have going on. Someone just asked the question, do you know how effective condoms are? How effective they are against herpes? It's like specifically or just in general? I mean, because in general, we know that condoms are effective, right? They're effective in lowering the risk of pregnancy, lowering the risk of any STD. I would say with herpes, it may be a little bit difficult, right? And it also depends on which condom you're using. For the female condom, you would have a greater, a wider barrier, because I don't have one near me, but you would have a wider barrier with the female condom than with the male condom. And remember, herpes is skin to skin contact, so I would say that yes, there is still a risk, but the risk is lower with the I wish I had a female condom to show you because they're wider, so they cover more area. That could be a barrier. So yes, it depends on which condom that you use, and I would promote using the female condom if you know that the person that you're going to have sex with has herpes. And people are actually that I've noticed from testing, people are very truthful, which is a very good thing. People are very truthful about, their exposure to herpes because it's so common. And you, again, cold sore blister, you have herpes simplex 1. So because it's very common, people are very, very outright and truthful about having it. So communication is also key. Any more questions? All right. We did not talk about COVID today, which I wanted to give you all a break from, because I know like a lot of our lives have been COVID and this, COVID and that, COVID and this, and we've been going through COVID for almost 2 years now. But I do want to tell you before I get off here that we do here at Whitman-Walker Health have the COVID vaccine. We have Moderna, we have Johnson & Johnson, so you can always call to schedule whenever you're ready to receive vaccination. If you are a DC resident, if you are a Maryland resident, let me see, I have information for you. You can make your appointment on covidlink.maryland.gov. If you are a Virginia resident, you can also make your appointment at vaccinate.virginia.gov or by calling 877-829-4682. All right. And that is all I have for you today. Thank you for the question, SD21AA. I appreciate you. That is all I have for you today. So until next time, I think I'm going to actually keep this series. This was the first one. It's called STD Talk. and we did herpes first. Chlamydia and gonorrhea are more common, so I feel like people have more information on that, which is why I didn't start with them first, but we'll probably get into that next time. But until then,